start?
Yes.
Okay, good afternoon, all. Welcome to this session of co-management of ophthalmologists and optometrists. We have a very esteemed panelist, optometrist Rajesh Wadhwa from AIMS, and he was also the optometrist of the year, senior contact lens practitioner. Apart from optometrist, he's a lawyer also, and currently running a lot of series and series of lectures under Optometric Education Trust. And we also have Dr. R. Krishna Kumar, Principal of Elite School of Optometry. He has done his PhD as well as Masters in Psychology. He has 32 publications at hand and very famous books, which is on occupational optometry. And he's, as I mentioned, is current principal of Elite School. And he also has done his fellowship in British Dispensing Optics. So we also have Mr. Ajit Bharadwaj. He's been on various forums. He's associated with associations like IOA, IOF, APCO, as well as WCO. He's the director of optics, and he's also currently a part of this Optometric Education Trust, where the webinars were initiated nationwide. And I give it over to Oli for introducing, maybe I should do KB also. Dr. Kishore Bandari is also one of the panelists, I believe. He's a senior optometrist, famous for his contact lens GP fittings, and he's been a lecturer too. And one part of our Aditya Jyoti Institute of Optometry in the initial stages. I will hand it over to Oli for the introduction of the remaining panelists.
Thank you, ma'am, for the introduction of the esteemed panelists. And today we got many of the AJOI alumni. It's very good to see them all together. And it's like an exciting moment that we're meeting after a long time. Now, not to mention each and everybody individually, because I'll be not knowing many of them, seniors or even the juniors. So what, as a colleague, we welcome this forum where we'll be talking about how we as optometrists can be part of the Tele Optometry program and co-manage the all aspect of eye condition with hospitals like Aditya Jyoti Hospital, where doctors will be available over teleconsultation, share your reports, get their feedback and management plan, and you can prescribe to your patients. So I was waiting Professor Dr. Natarajan to join. Probably he will join soon and then share his views. Meantime, I would like to invite once again Thanuja ma'am to share her experience as a journey of as an optometrist in this world. Yes, ma'am. If you can share your screen, please.
Are we ready to go?
Okay. I think it's ready. You should go ahead.
Yeah, let me start off by thanking Dr. Professor Natarajan for this memorable opportunity to be part of this webinar. Apologies for starting a bit late because still we were waiting for Professor Natarajan to join us. I would also thank the esteemed panelists for agreeing to come down here to share their views also, and the coordinators Hamza and Oliullah. Yes, I feel humbled and honored to share this feeling or the journey of my profession in the optometric career. Let me start off by trying to understand the origination of the word optometry. It started off with scientist Verscoor of Holland in 1865, and the oldest optometry college dates back to 1872, and that was the Illinois College of Optometry. Now, science always fascinated me, and my trajectory into optometry began as way back in 1988 when the medical college opportunity did not come through because I was considered as out of state quota, which was a small reservation for candidates outside the state. I was neither considered as the state of the place of my birth, Chennai, nor Kerala. So that's where I lost it. But I refused to join any ordinary college. And that's when I stumbled upon this advertisement of Elite School of Optometry, defining the science of optometry. I feel a rush of nostalgia when I think of my college elite school, which is under the unit of Medical Research Foundation, Shankara Nethralaya, translated as Temple of Vision, and I belong to the fourth batch. And under the mentorship of Dr. Sengamedis Srinivasa Badrinath, the Padma Bhushan recipient, and also Professor late Dr. E. Vaidilingam. And he's one of he is the ex-principal of Elite School of Optometry and one of the senior optometrists who got into Ellen Brooks Academy. He's an Ellen Brooks instructor at the Academy of Ophthalmology. An ophthalmologist initiative in creating an optometrist to serve and have more hands in eye care is not credited enough. At Elite School of Optometry, we were nurtured and academically cared for by more of ophthalmologists then. Dr. Badrinath, Dr. Lingam Gopal, Dr. L. Vijaya, Dr. Surendran Ravi Shankar, Dr. Dave, Dr. Chella, and many more eminent. And I cannot forget one of our optometry lecturers belonging to the first batch, optometrist Satya Chandrasekhar, and also Professor Sukumaran, who traveled all the way from government hospital at Egmore, Chennai, to teach us optometry at this college. Drink plenty of water. I cannot forget the lines of this mathematic professor. KK would agree. He, professor, who he actually is one of the excellent teachers in mathematics, I would say. What is special about Elite School of Optometry, I believe, is the way they taught us to respect ophthalmologists, patient care, and also get committed to discipline. And this principles got sharpened as I got into a job first time in 1992 when I passed out at Dr. Ravindran's Eye Hospital. I know him as one of the best employees I ever found at his place, because he even used to pay the registration fees for conferences. And at Udi Hospital, Dr. Ravindran and Dr. Parthasarthi used to give us freedom of work. There are two of us, myself and Geeta, my batchmate. And we are very thankful to Jayashree Vishwanath, another batchmate who was instrumental for us to have us linked up with Udi Eye Hospital. Bausch & Lomb offer in Mumbai in 1994 was a destiny changer. I would say God was playing with me in that short period of times to get my feet at the commercial capital Mumbai. Following Bausch & Lomb, I got exposure to Asha Parekh Hospital and also Dr. Eye Institute before I became an academician. Now, that opportunity was given by one optometrist from Mumbai, Nilesh Chauhan, who introduced me to the late Naval P. Baliwala sir, who asked me to come to Municipal Hospital to conduct lectures. Now, Baliwala sir is one guy who would go to any extent to improve the quality of education. When I had challenging times in Mumbai to continue the lectures as a visiting faculty when I was still not employed, it was him who gave me a token of fee to go and continue lecturing there. Since I had academic qualification and I was already being a visiting faculty at Municipal Hospital, they motivated optometrist Nilesh and Baliwala sir motivated me to join Municipal Hospital, and I was employed in 1996, though I was a non-Maharashtrian. I'm grateful to all those top officials at Municipal Corporation of Greater Mumbai, Maharashtra, for not only giving me a job, but also providing me accommodation at Mumbai. At Municipal Hospital, we started everything from scratch. I'm sure if optometrist Usman is listening, Sadiq Sapadia is listening, they would definitely nod with a smile that we started from scratch, including putting up the board for School of Optometry. We cleaned up the classrooms which had a lot of, which was a home for a lot of DAOs. We revived the hostels for all those students who came out of Mumbai state, like Nanded, Malegaon, Aurangabad, and these states. And I would say these students from humble backgrounds which supported me in giving a new face to School of Optometry. Now, Municipal Hospital also gave me vast exposure to be an external examiner and also a faculty at various other colleges in Maharashtra, like the Bharati Vidyapith Deemed University, HHK College, which is now the Lotus, and also Nasik College of Optometry. Then we didn't have this short-term courses. MEH clinical OPD was very unique. When I turned from Shankar Nethralaya, where we were exposed to advanced diagnostics, we jumped into a place, and it was like initially I was taken aback, but then I became an expert in torchlight clinical diagnosis because of the least equipments we had there. Honestly, I've seen only spot retinoscope in a book, but it was at Municipal Hospital I actually started practicing, because at Shankar Nethralaya we used to do streak retinoscopy, and this strengthened my skills. And eventually I became a community-based optometrist, where even with minimal diagnostic equipments, just with torchlight, some conditions can be easily identified. And it's noteworthy to mention, again, at Municipal Eye Hospital, the doctors, the ophthalmologists, they were very supportive. My experience with the ophthalmologist was always very nice. I don't know, it was my luck or some vibes between me and them. Dr. Bedgi and also Dr. Kalani, they were very supportive during those times. And my siblings also got to learn optometry and change their profession. MEH also is one of the centers for training ophthalmic surgeons. So when they were posted as internees, they came down to us to learn at the OPD. And late Naval P. Balisava, sir, Dr. Murthy, optometrist Nilesh Chavan, and myself continuously strive to upgrade the course from diploma to degree at the Municipal Hospital. And I nearly went to resign when Baliwala sir's project of Haji Bacholi came through, but actually didn't materialize. So I decided not to resign again. And that's when the Lotus College, formerly HHK, was formed by both of them, optometrist Nilesh and also late Naval sir, and headed currently by Prema Chandi. She's also from Elite School. Municipal Eye Hospital also has students who have currently done their masters and upgraded themselves, bachelors and masters, and upgrade themselves. Experience is definitely the best teacher. You will find me keep referring to ophthalmologists, as I consider myself the ophthalmologist baby or product in the 28 years of my professional career with them, and with negligible differences here and there. And one such remarkable, I wish Dr. Natarajan comes through at least now. I have a few lines for him. One such remarkable and versatile game changer, I would say a thought leader, an ophthalmology brand, Padma Shri, Professor Dr. Natarajan. I've worked with him at various clinics, right from refraction, contact lens, low vision, macular clinic, photodynamic therapy, which was first of its kind in India at Aditi Jyot under the guidance of Dr. Natarajan, and retinal surgery counseling, and finally the academic head of Aditi Jyot Institute of Optometry in 2004. During all this period, he gave us the independency to do, and I repeat the lines I do in various occasions. If the ophthalmologist is confident about his surgery, there is no way he's going to interfere or correct an optometrist's refraction or get intimidated by us prescribing medicines, as long as it is within our scope. It was after giving much thought and with the support of Professor Kishore Bandari and Sujay Dangi, as well as late Professor Arun M. Vasa. He passed away yesterday, 10 years from this year. And I took the major step of resigning from Municipal Eye Hospital and joining Aditi Jyot. And within a short span of 2 years, we had affiliations with the Indian Optometric Association, International Association of Contact Lens Educators, and the Indian Eyecare Education. And that time, we also tried Yashwant Rao Maharashtra Open University. It was an incredible moment for me to have organized the first graduation ceremony of Aditi Jyot in 2007, when we had that lateral entry system. Coming to Botswana in 2007 was just a family visit where the siblings were already employed at an organization called Opticals Botswana Group. And Botswana, for all of us to know, is a country which is landlocked by South Africa, Zambia, Zimbabwe, and Namibia. And it lays across the Tropic of Capricorn. And this country is the largest exporter of diamonds in the sub-Saharan Africa, with good governance and prudent economic management. Believe me, what is so unique about this Pula country, Pula means rain, and it's also the Botswana currency, is a very peaceful heaven of social life, not only social life, and we have very good harmony between the ophthalmologists and optometrists than anywhere in any part of the world I could reckon. Scope of practice is well defined in Botswana by the underlying principles of Botswana Health Professional Council and also Ministry of Health and Wellness. Though at the initial stage I had a bit of struggle because in South India we use initials, unexpanded initials, and when we go to West we use surnames. And few people came to my rescue, and Dr. Krishna Kumar support letter from elite school when he as a head, and also some MEH alumni as well as Aditi Jyot alumni, Optom Ice Candy Wala also supported with the gazette work, and eventually the Botswana High Commission in India authenticated my certificate and I could get into registration in Botswana. I must say there's a handful of ophthalmologists here, only a handful, 6 to 7. We can name it like Dr. Mataga, Hanifasi, Bangure, Dr. Ann, Gasawu, Duku, and these people do not focus on refraction, rather refer to optometrists, and they combat the blindness, the leading cause being cataract, which is common worldwide. Just like Professor Dr. Natarajan in India, I find Dr. Mataga a close friend and a professional partner in her, a professional life partner in her. And that's because of the principles of practice and perfectionists. Incidentally, both happen to be Virgos. The underlying reason for this harmony is we stick within our scope and also know our limitations and boundaries. I worked as an employee at Opticals Botswana Group for 5 years, starting from 2008, and my first salary in Botswana was handed over to my alma mater, Elite School of Optometry, for the outgoing student in community optometry, because I'm very passionate about serving the underserved. And this was constituted in the name of my late father, Mr. C.N.S. Panicker. Apart from optical clinical services, I also moderated various sessions for the group for Optoms working within the Opticals Botswana group, and I also tirelessly served as a founder member of Botswana Eyecare Providers Society, which has 3 cadres: ophthalmologists, optometrists, as well as ophthalmic nurses. Eventually, we formed Botswana Optometrists Association in 2012. And I'm still the secretary. We are waiting for the AGM and have change of officers. And I'm deeply thankful to another ophthalmologist, Dr. Onka Masana, who gave me the first opportunity to speak in Botswana in front of Ministry of Health and Welfare officials. And I spoke on role of optometrists in the prevention of blindness. I also participate in a lot of the World Sight Day commemoration programs of Ministry of Health. Currently, I'm running my own practice, Eyelight, with a vision beyond sight, and encouraging people as well as creating awareness that 80% of blindness is preventable, and get your eyes tested regularly, for which I do a Sunday free program for the needy or the underserved without charging consultation while I run a private practice. It is difficult to speculate the greatest, it is difficult? No, not difficult to speculate. The greatest accomplishment is seeing a crack of smile as an impact of improved vision of a patient. The opening of private practice opened doors for me, not only to do normal eye care service delivery, but also give me the freedom of community eye care. Through Eyelight Optometrists and also various organizations like Health First Foundation, we do with Sai Trust, with the support of Dr. Kadiala, Peak Botswana of Ministry of Health and Wellness, People with Albinism, Special Olympics, and also Art of Lions Club International and Art of Living. Now, there was a special case, a special thing I need to share here when the Art of Living coordinator, Mrs. Savita Sharma, arranged and organized for a group of people to be brought in at the center. And these were stigmatized people suffering from HIV. And we did clinical services and they provided glasses. Now, in 2012, there was another experience where the Seeing and Believing project of Standard Chartered Bank came to conduct eye screening program with professionals, I mean, for the staff. And I happened to tell them that I will convert all the professionals' fees, and it was handed over to Mr. C. Ilongo, then the president of Botswana Tamil Cultural Association. And this amount was utilized for doing cataract surgery by the team of ophthalmologists who came in from Shankar Nethralaya. I'm sure you know the head of the team. He's popular among the webinars, Dr. Rashmin Gandhi. And there's the last pre-COVID period, we did a community service 600 kilometers away from the capital city of Botswana. And that is because of Honorable Sam Brooks. He gave me an opportunity to serve Ben. I've been serving as a district chairperson for sight preservation through Botswana, Zimbabwe, Malawi earlier, and now Botswana and Zimbabwe. Every year we do free clinical services throughout Botswana in the month of October, World Sight Month, and in Zimbabwe during it's a combination of World Sight as well as World Diabetes Day, which falls on November 14th. My practice also contributed to the Melvin Jones Fellowship Award, which is the most prestigious award given by Lions Club International, and this was bestowed upon to a lion. And she's also the former speaker of the National Assembly, Ma Kokorwe, Gladys T. Kokorwe, for her generous and phenomenal humanitarian services to the country of Botswana. I shall strive to show consistency in serving people of all walks of life, especially the underserved. And being a vocal opponent of quacks, I'm not convinced at all that we optometrists cannot go and serve at rural villages or cannot spare a little amount of time to the underserved. And then where's the room for quacks and VTs sitting up there? I even wonder why some organizations are keen on training technicians and eye dushmans that seep into our system with the concern for Indian prevalence of blindness. The prevalence of poverty in India is 22%. The blindness is only 1%, according to the 2011 and 2006 statistics. So I encourage these organizations rather create farm technicians and assistants for small-scale businesses in India rather than VTs and eye dushmans. Let me recall the lines of the former Vice President of Zambia, Honorable Simon, in 1961. If we do not handle our independence well, colonizers will come back in the form of investors. So we optometrists are exactly not rigid. We are open to constructive change for the progress of optometry, like what Professor Natarajan brought in today, like co-management of optometrists and ophthalmologists. That is appealing to us. And this will also strengthen our bond in a symbiotic relation. With the support of my husband, this journey of eye care service continues. Thank you.
Excellent, ma'am, for your wonderful insight of the journey as an optometrist. Now, I would like to invite Professor S. Natarajan, sir, to come and start delivering his lecture, and then we can have sessions, question answers with our esteemed panelists. Yeah, sir, Professor Natarajan, if you can come up.
Okay. So, good afternoon to all of you. Thank you, Thanuja, for a wonderful presentation. I'll like to have a copy later. So, am I audible, Oli?
Yes, very much,
okay.
Sir.
So, I'll now shift to the share my screen. Okay.
Hold on, it will ask you to Yes, sir. You can do it now.
Okay, I can.
Can I share it now?
You can share one.
Okay.
So now you can see my screen.
Not yet.
Yeah. Hello.
Not yet, sir.
Yeah. You're able to see.
No.
1 second. Now.
Yes, visible.
Now can you see?
Yes, we can.
Okay. So thank you, Oli. Thank you, Thanuja, and my Hamza from our Origination Optometry. So I'm happy to be a part of the Tele Eyehealth services, co-management by ophthalmologists and optometrists in India, the Indian Eyecare. So today is actually Dr. Ferdinand Monoyer's birthday, May 9th, 1836. He was born, and he was a great ophthalmologist. He also was a professor of the medical physics. And as you see here, you see his photograph and his Monoyer chart. And then you also have an Indian postcard which says refractive error, and which is actually consult an optometrist or an eye specialist in the card. And I'm happy this was done by Government of India, by the National Control for Prevention of Blindness. So we remember Dr. Ferdinand Monoyer as an academician, an eminent ophthalmologist, a physicist, and who invented the measurement of diopter. So all optometrists use diopter, and you can imagine in 18, he died in 1912, so I think the late 18th century, early 19th century, the diopter was born. And teleophthalmology is a branch of telemedicine that so the So teleophthalmology is a branch of telemedicine that delivers eye care through digital medical equipment and telecommunications technology. And today, applications of teleophthalmology encompass access to eye specialists for patients in remote areas, ophthalmic disease screening, diagnosis, and monitoring, as well as distance learning. And I think this is the purpose of today's webinar. And teleophthalmology practices are being practiced in India by Natarajan, Hospital, Aravind Eyecare, Wellcare Health System from Chennai, Tripura Teleophthalmology Network, AIMS Delhi, Jipmer Pondicherry, LV Prasad Eye Hospital, Hyderabad, Narayan Netarajan. And
Sorry to disturb one second. I think a lot of background noise coming from your room. So if you can ask your person who is making little noise.
And so the teleophthalmology objective is, as you see here, this is a Shankaranathala Teleophthalmology Central Hub. They have connections with other ophthalmic hospitals for a second opinion, connected to mobile service van, continuous medical education, higher learning center, tele-mentored procedure for surgery, higher research organization, public awareness, and also as a service center. And this is the first mobile unit. You can see it was inaugurated on 10th October 2003. And that time they used ISRO, the Indian Space Research Organization. And they are also doing a comprehensive eye examination in rural areas at patients' doorstep with spectacle dispensing. And this was the dream project of Dr. Abdul Kalam. And when it became bigger, the Chief Minister at that time, Jayalalitha, and also President Dr. Kalam inaugurated the expansion of the mobile telemedicine through mobile ophthalmology, eye screening for school children, and awareness on eye ailments in rural areas for the public. And this is a mobile refraction van, which again managed totally by the optometrist and it's done along with SLR. And they have about the total camps, they have done about 3,000, and then a total number of patient examined is more than 6 lakhs. And in the Arvind Eyecare system, Dr. Nambar Swami started, and now Dr. Kim is managing. They have a vision center for every 50,000 population, permanent low-cost eye care facility to reach the unreached, aim to provide primary eye care and referral services, manned by a trained technician and linked to base hospital with a wide bandwidth, more than 736,414 teleconsultations. They are one of the biggest teleconsultations they are doing. And this is the vision center process. They have the data sent to the base hospital, and this is being done using the mobile phone now, and with a simpler technology. And you can see the vision centers are there. They are having about 64 totally, with the 12 main hospitals. And Tripura Vision Center project is from Ministry of Health and Family Welfare, where they have the Department of Health, Government of Tripura, and ILF has set up this with the help of Arvind Eyecare. There are Vision Center database served is located in the Indira Gandhi Memorial Hospital premises at Agartala, and they serve a rural population of 27.18 lakh remote areas. There are 6,47,745 villages in India, and our Prime Minister is able to contact all the village heads. So I think similarly we should be able to, with the help of healthcare workers, optometrists, ophthalmologists, and our own Ayurveda philosophy of using non-medical people to do the vision screening and take the retinal photograph. And L.V. Prasad has a tertiary, like a pyramid or a pyramidal model for eye care, and AIMS has a video consults, and which they inaugurated on 14th November 2016. And then Well Health, Dr. Sendil is an ophthalmologist who is doing a private business preventing blindness through affordable telemedicine technology solution. He's using Forest camera made in Bangalore. An innovative diabetic retinopathy care model. They have equipment deployed in diabetes hospital, and the images are sent viewed remotely by ophthalmologists, and final funded report is sent back to operator. And this is done through the Teleopia software. Karnataka internet-assisted diagnosis of ROP is being done by Dr. Anand Vinaykar, and which is a triple T philosophy of tele-ROP, training of peripheral ophthalmologists, ophthalmic assistants, and talking to neonatologists, pediatricians, and gynecologists. And this is called the Kidro Narayan Netralaya. And the future leaders, that's the aim of the webinar, role of an optometrist as a future telemedicine, tele-ophthalmology, tele-optometry, which is what I hope to start in a big way. And Altitude can be the lead. And Zeiss and the optical companies and ophthalmologists engaging each other in symbiotic relationship, benefiting each other. I just put Zeiss. It can be any company, franchise-based model for tele-optometry, webinars and corporate events, which are co-branded to co-promote ophthalmologist practice and optometrists. And the ophthalmologist and optometrist working in partnership, we can have the patient visit the optometrist clinic and optometrist diagnosis, and give the opinion and sends it to the ophthalmologist, where they can have the diagnosis and the results shared between each other, and patient referred to the consultant ophthalmologist only for specific treatment in the form of surgery or injection, and rest of the things can be done by the optometry. An ophthalmologist conducts diagnosis through teleophthalmology, and optometrist shares details with patient, solution provided to the patient. It's a win-win situation for all the stakeholders. An application of telemedicine by optometrists, diagnosis and formulation of treatment for diabetic retinopathy, refraction, screening for cataract and glaucoma, imaging of the anterior segment, the electrodiagnostic and electroretinogram imaging, then consultation of patient for low vision problem, referring ophthalmologist for mainly treating retina. And here you can see these sort of handheld devices are available, smartphone-based retina screening, or something like the portable mobile screening, where we are actually optometrists can do, and we can train non-medical people, like what we have done in Aditya, where we have trained school dropouts to use these sort of phone, and we have published that in JAMA. We are working with National Skill Development Corporation of India for giving them, so that their role will be only to take fundus photograph, and wherever required, 1% topic might be used, keeping the secondary glaucoma in mind, which can be 1 in 100,000. there can be integrated stands with the fundus and refraction. This is a Forest one where they have made, and they also have an handheld Abero, so a laptop for the to the left of the operator. So as a president of the All India Ophthalmic Society, I introduced this nationwide diabetic retinopathy screening, stop screening through teleophthalmology, where we called it as a screening through teleophthalmology to prevent diabetic blindness. And in Hindi, I called it as Jot Se Jot Chala. Using this, thanks to Forest, they gave us the camera that were being used in Jharkhand. And this we started in January 2019. And then we also did it in Kumbh Mela. They called it Netra Kumbh. They were only doing refraction and giving glasses. And we introduced the diabetic retinopathy screening, where we used the remote Forest camera they handled. The medical college students of Allahabad Medical College, headed by Dr. Kamalji, helped us. And we have made a diabetic retinopathy task force in All India Ophthalmic Society, headed by me as the chairman. And we have Dr. Ajit Babu, Lalit Verma, Dr. Rajiv Raman, and many. And this is what was done all over India. We have done about 3,000 camps the last year. And thanks to Remedio, was screened about 4 lakh patients. 4 is about 3.83. Artillery is about 72,000. And Zeiss, like that. Cipla has done about 7,255. And now this is what we have done. And I think we can include Akhil in the discussion after my presentation. And this is what we have created as the Joe's Diabetes Clinic. And I think the telemedicine or teleophthalmology software, we can introduce this to have a virtual appointment. And I feel optometry and ophthalmology is difficult because doing a refraction and a fundus examination at home is a problem. But we can work, like Thanuja is ready to work with collaborating with the ophthalmologist of Botswana and Aditya Jyot, where she will be the main person to make the initial part of the examination of the patient. We'll have the report, which will be merged with our medical records, so that we have entire data as though we are examining the patient. Only thing is a remote examination. We depend on the examination report of the anti-segment by the ophthalmologist in Botswana, and then they send the reports to us, and then our ophthalmologist can give the diagnosis and also suggest the treatment. And for retina, she said there's no retina surgery being done, so they can be referred. Similar thing can be done for diabetes per se, where diabetologist of Kiran Shah can be consult, and they can directly consult. We have 2 software, one through the web and other through the mobile app. And then this is again, there's a webinar being held by Telemedicine and E-Health, which is they actually call it handling the COVID-19 crisis. They wake up to call to revolutionize telemedicine. I'm happy Government of India has also revised the telemedicine rule. I'm a member of the Telemedicine Society of India, and which Dr. Salukumar was a president last year, and now there's a change, and we regularly present and as a part of the telemedicine. And telemedicine also is changing because we cannot get everything done at the patient's house when there's a lockdown. And we are now using more of a telecounseling and a teleconsultation based on the report sent by the patient, keeping the including the medical legal risks involved. And this is my grandfather, Dr. Natarajan, was a ophthalmologist in Government Eye Hospital, which is the oldest eye hospital in Asia and the second in the world, and which we celebrated 200 years last year. And he was in charge of the refraction in Government Eye Hospital in 1930s, and later in Tanjore and entire Madras Presidency. Later, my father served the Government Eye Hospital in 1955 onwards till 1987, and where we have a lot of optometry, and we have the first optometry school started by Government of Tamil Nadu in 1948 in Tamil Nadu, and also the first eye bank. So I think Madras has been a forerunner, and I also was trained in the same Government Eye Hospital, which is attached to Madras Medical College. So I'm glad we are working with optometry, ophthalmology for the last total man-hours of 150 years of service to the country. And this is, I salute my Mata Pita Guru, Dr. Badrinath, who was a great visionary, who started the Elite School of Optometry in 1984. And even that time, there was a lot of furor over ophthalmologists wondering what will happen if you create more qualified optometrists. And I think he stood by the principle. He convinced the elite industry, the optical industry from Mumbai, who gave the first donation and started that in India, and I think it's grown. I'm sure Krishna Kumar will be part of our panel, whom we will have discussion. And finally, my friend Shivanandan, who's behind me for serving in Dharavi, apart from my father, who insisted. And 2004, we started Aditya Institute of Optometry thanks to Thanuja. And 2005, we started Aditya Foundation for Twinkling Little Eyes. And Aditya Eye Hospital was started in 1990. So I want to tell this as my inspiration, and this was there in my father's car even from 1963. I remember even as a kid. This is arise, away, and stop not till the goal is reached. He actually mentioned this in 1895 or so when he actually was in Madras. That's how the Vivekananda Illam, that's the Vivekananda House in Triplicane, which is facing the sea next to the Queen Mary's College, has that where Swami Vivekananda visited and was living there. And then from there he collected with this idea from his friend, who went to Chicago by ship and made that historic talk, which I visited there. So I want to say that we have to have a goal. The goal should be to reach every Indian, which means 1.3 billion people needs eye examination, whether it's during COVID or post-COVID. And I think unless we all come together, we will not be able to reach that goal. And as a diabetic, every year we have to examine the retina, not only the eye, not only the refraction, the retina of the eye. And so I think we need optometrists and non-medical people, community health workers to do that. So our goal is far-fetched now to reach, but nothing is impossible, because in the word impossible, I am possible is there. And I have decided in the next 5 years, I'll be able to screen all the 1.3 billion people through various teleophthalmology, which I promised last year. And we have 77 million diabetics. But now during COVID, I think everybody is forced to do things from home, like including the webinar. I think we can also do some vision screening. And we have Dr. Mr. Ajit Bharadwaj and Rajesh Wadwa and people from Indian Optometry Association and other schools. I want them to do brainstorming how we can do eye examination, like in the form of vision check. And I saw my other ophthalmologist has made use some software in the YouTube. I can probably send the link to all the optometrists who can use it for checking vision at home. So thank you. And Akhil, you have some slides with you. So I am stopping sharing my slides, and can we start the panel discussion and question answer, Oli?
Yes, sir. I think a very small presentation from my side, as I was asked to present about my journey and at AJOI and how telemedicine or teleophthalmology can be worked out.
Right.
So, to introduce myself, I am very much a.
I will introduce you, Oli. I think Oli, we call him a short form. I think he came from West Bengal and joined Aditya Institute of Optometry. And my father was the rector for the Aditya Institute of Optometry. And I think he was his favorite student. And always, my father used to represent the optometrists and come and fight with me, saying that you are not giving this as ophthalmologist, you are not supporting it. Because I think in spite of I support, he wanted more. And I was always, it was a healthy discussion, even though we used to argue very. And then after that, I think he did his master's. And then later, he's an innovator. And I think he's made a software, which I think he'll be the best person to do. And I so happened met his investor, who's part of the visit called Vivekananda Engineering College, where it's called the Vivekananda Education Society, which is there in Chembur. And one of the trustees is an investor, and he was very proud of him. I'm happy he has, by his own merits, he got this investment and does the software. And I think our optometrists are still crawling to learn from him, and I think they are not able to do that. And we are using the Shankar software for the binocular vision. But I'm happy Oli is a part of it's an Aditya product, I can proudly say. And anything else I missed, Oli?
No, it's actually a great honor to be introduced by you, sir. I think rightly mentioned is I'm one of the very close associate with Professor Sundaram sir, and definitely I got many key people who.
I thought you're close to me also.
Yes, so coming to that, there are many more people who influenced my path in path of optometry. Is one of them is you. You taught how to be multitasking and be focused on your work. So even though you talk to 10 people of different discipline, you keep focus how to where to stop and where to again restart from exactly the point you stop. So multitasking ability is one of the crucial things we learn. Apart from patient management, you are there for patient
I can
management.
see Hamza is jumping there.
Yes, he will not comment at this point of time. Now there are other people who influence me at Aditya Jyotis. One of them is Dr. Mihir Kothari, who inspired me to be part of pediatric optometry and get involved more and more in pediatric optometry. Then there was Dr. B. Vidyashankar during my internship. Again, he influenced me to be a better orthoptist, a lot of binocular vision teaching from him. And then not only that, I went into a management of when I joined back in Aditya Job 2010 after my post graduation or post fellowship from LB Prasad. So it made me a better administrator, and that took me a path of doing a management course, an MBA in hospital and health administration, and took the challenge to lead chain of eye care hospitals in the name of Krishna Eye Center. Three of them. Later on, I had to dissociate with Aditya Jyot for some like reason, which is everybody knows that the management would sometimes leads to this kind of breakup that happens. But during this tenure as my Krishna Eye Center and great influence from Mihir sir and Vidyashankar sir, and my great buddy Vikrant, I think I learned a lot from him. And then we got into this program of developing something for tele optometry practice. It is both for in clinic, which you can practice in clinic of any of the hospital or eye care setup or optometry practice, or during this post COVID scenario, or during this scenario, you can actually or remotely perform this whole lot of optometry activities, not to refraction, but apart from subjective refraction, many more things. So let me share my project where I wish to explain or brief you about how we can be very much part of optometry practice. So I'm just showing you a remote software, which is going to be projected on your screen. And this is exactly how you need to do when you are doing this practice. So there are clinical findings where you can record all of your patient database, and in the diagnostic section is the crucial. You can do lot things into it. So let us do what all things we want to do as a remote condition. So first and foremost that we used to do is the visual acuity assessment for a patient. And when you used to do, there are many rudimentary methods. You can share your image to the patient. You can have different charts printed, but you are not sure about the accuracy or the quality of the things you are getting. So we got this versatile chart developed, which you project onto the patient screen, select the desired distance. For example, if you are taking 2-meter distance, you do that, project the screen, you have a 100% contrast chart, 10% contrast chart, and there is a log contrast chart. You have option to select alphabetic and numeric based on the education level of the patient. And once you project this chart onto the screen, if you can see here that it is being projected a complete logmar chart, and which is very important. So it is a validated chart, and thus there will be no error in your vision recording. Now, for example, if somebody closing the left eye and reading the last line completely, that means they have 100% vision. So you just press the enter key to record this visual acuity. And when it goes to the other eye, and suppose you wish to check whether, because this is a logmar chart, if I'm not able to read 2 optotypes from the bottom, so you need to highlight as that patient could not read from remote section. and then you highlight it as a red. So you can see that it is giving a precise recording of the vision. It shows the 6 in the right eye and the 6/6 minus 2 optotypes which are missed, and like 0.04 logmar. Now this is not just a checking a vision and giving a rough estimate. It is actually a true vision recording that you used to do. There are many neurological conditions that you need to do their contrast assessment, or there are conditions like diabetic eye screening. So again, contrast acuity function or the chart is very important. So you got a 10% logmar chart. Again, you project. If you can observe that every time this is a new subset of the chart which is getting formed, so nobody will able to remember what was actually there earlier and mug it up. So again, it makes it versatile or giving a more accurate results. Coming to the log contrast evaluation, you see there are triplets which are coming with slowly decreasing contrast, and at one point in time, suppose patient is not able to read any further, you select the last correctly read triplets. So as you know, to evaluate this, you need to have many diagnostic tool, and remotely it is not possible to send all this chart to the patient's home and do the evaluation, whereas in this period of teleoptometry you can project it and nicely evaluate. Coming to the next evaluation that we used to do is for this group of patient to identify whether there was any neurological issues or not. So we got a contrast evaluation chart developed, color vision chart. So the moment you project the color vision chart, you have option to do with a traditional Ishihara, and then you have something called D15. So let me show you the Ishihara, how it projects. Now in this chart, you know that these are the original vector images. It's actually more accurate than the printed one, because over a period of time the contrast goes off of this vector charts. But in this, it is exactly same and independent of the screen resolution or the quality of the screen. So because you need to calibrate it once for the first, and it will remember all the settings. Once you are done, it will give you interpretation as well at the end of this program. Now coming to the next aspect, which is again going to be a very important in our optometry practice. Now, the moment you diagnose some certain patient with in respect of binocular vision, I'm talking about that. Now, when you diagnose certain patient that they got some issues with their accommodation or their fusional divergences, or patient diagnosed to have amblyopia. Now, till now, you could call them in clinic and spend half an hour, 45 minutes time. But post-COVID scenario, probably you wish to be as less as possible, because you don't want to crowd your clinic for a long period of time, patient sitting or the attendant waiting in the waiting room. Now, again, we thought of making it a teleoptometry program where you share your screen that you wish to train this particular patient. For example, if you wish to train patient on amblyopia, you project the screen of the amblyopia activity, control all the functions based on the patient's response or the acuity, you control them, and then let the patient respond to the games. For example, this is one of the activity I'm showing a brief. I'll not take more time. So this one of the activity, it shows that patient needs to have some goggles like this. Again, you can courier them from your practice, or you can share the Amazon link from where they can just get these goggles, and remotely you can start treating this group of patients. So doing a remote vision therapy program and nowadays I'm doing a lot of patients, especially from India and abroad, in US, UK, all this patient. So this is efficiently delivering my scope of work. So I would request many more people or more colleagues to get engaged with teleoptometry practice. And whenever you suspect there is a disease condition with loss of contrast, loss of visual functions, or loss in color vision, immediately consult your tele-ophthalmology partner, which in this case, as Professor Natarajan says, he will be happy to be part of the group practice where you can share your details to one of the clinician in Aditya Jyot, and they will interpret the results, suggest you the probable management, as the Schedule A drugs can be prescribed by help of teleophthalmologist. So on behalf of them, you can write the prescription. And in emergencies like optic neuritis and certain condition, those Schedule B drugs also can be prescribed as a tele medicine module. I think this is the learning, probably I got it from Ajit Bharadwaj sir and Rajesh Vadda's presentation. So probably they are there in panelists. They will enlighten on the scope of which all things can be prescribed as a co-management protocol. So your scope of work is widening day by day. So dear colleagues, so it is a time where we should collaborate with all the practitioners, with optometrists, with ophthalmologists, so that we can expand our eye care services to remotest possible location in the world. I would like to stop here and open the discussion with the esteemed panelists. Thank you giving me this opportunity to present in this forum. Now I am unmuting all the panelists. Please come and switch on your camera.
Thank you, Oli, for a wonderful presentation, and thanks to Thanuja for starting. And I see a lot of common names here. And first, I thought I'll ask Akhil. He wanted to. Akhil, I want to introduce Akhil Naicker. Akhil Naicker is MBA from worked with Ireland for some time. And he came back in March, and after that he's in lockdown. So he came via Dubai, so he was quarantined 2 weeks, and then we have not met each other except through webinar. So he is looking after the telemedicine, tele-ophthalmology, tele-optometry initiation in Aditya Jyot, which we are doing from 1st April, rather last week of March. And we have introduced 2 softwares. So I think he can talk about what is currently happening in Aditya Jyot and what is the future for teleoptometry. Akhil?
Yes, sir.
You want any slide?
I have a slide. I have just one slide to share, which I'll just discuss on that also.
Only you can give him permission to share the slide.
Yes, I did so. He can go ahead and share the screen.
Thanks, Oli.
Meantime, there is a question from Ms. Gitanjali Astha. Yes, Ms. Gitanjali, can you come up with a question? I'm just unmuting yourself.
Yeah, I was just wondering, how does one participate in telemedicine? Because I would also be quite interested in using and sharing information with fellow optometrists and ophthalmologists.
Gitanjali, that's I think I'm happy. I should thank Mr. Ajit Bharadwaj for even my idea was there and he putting me into and every time involving me in the optometry webinar. Thanks to Oli. So that's what we are discussing, and I put Akhil with an MBA background to keep this as a business model, so that how it will work with various types of optometrists all over India. We want to start with Mumbai, and I hope Oli and Nanda can arrange it, and then with Thanuja and Botswana. And so I think probably Akhil can talk about that.
I'm also Thanuja schooling, and I'm also in Botswana, sir, right now.
Oh, you're in Botswana. Okay. So,
Hello.
yes, Akhil.
Yeah, if I'm audible. So thank you, Dr. Natarajan, for giving me this opportunity to speak on this platform. And I would just want to touch on this one slide and the importance of this slide in the way we are going ahead in terms of taking telemedicine in the use of optometry and collaborating that with ophthalmologists. So considering that business has taken a beating with the current pandemic and the lockdown situation seeing prevalent everywhere, I think the future which would be based on this kind of a model where the role of an optometrist as a future leader would change enormously. So the optometrist would be obviously the first point of contact with the patient, who would be in charge of getting to see the issue or the problem in first hand and creating the diagnosis right away and starting off with the patient. So in our Aditya Jyot Eye Hospital itself, we are being managed ably by a team of optometrists during this COVID-19 crisis, where they are not only going about their routine work, but also in charge of the first point of diagnosis and intervention when they're addressing patients who visit our hospital in terms of emergency. So the role of the optometrist has gone up further with the aspect of early detection and preventive care, which can be kind of addressed to the patient, so that the patient goes ahead with diagnosis and visits the ophthalmologist or practitioner right on time. So that gives more importance for the role of optometrist in educating the patient on the health of the eye. So moving on to this slide here on the patient journey. So what happens here is the patient in a franchisee kind of a model, working with ophthalmologists as well as the optometrists. The patient first visits an optometrist at an offshoot site or a optical shop or a unit, where the optometrist first gives diagnosis to the patient, provides an opinion, and then the diagnosis is shared with the patient. Further, the patient is referred to the consultant ophthalmologist for consultation. Then the ophthalmologist conducts the diagnosis through teleophthalmology. So the patient need not kind of go to the ophthalmologist or to the hospital. So the patient is directly addressed by the ophthalmologist while being seated at the optometrist site itself. Then the optometrist shares the details with the patient. Once the details are shared, then the solution is provided to the patient. So eventually, it's a win-win situation for all, where the ophthalmologist gets a steady stream of business by the patients who are visiting at the optometrist site. The optometrist also has a readily available ophthalmologist 24 during duty hours, when the ophthalmologist can treat the patient who is coming inside at their site through a telemedicine platform, and the patient is also satisfied due to a quick service, which is a win-win situation for all the stakeholders. So I guess this is the way forward in terms of collaboration by ophthalmologists and optometrists, and it would be a very strong partnership benefiting everybody in the future.
So already Akhil has made a business plan, which I partly shared with Mr. Ajit, but not the detail. Same thing with Thanuja. So I think it has to be a business model, and wherever patient cannot afford, we can do charity, which we are doing. Like I'm as a Roti Bank, you can see my badge in my coat. We are giving 30,000 meals all over Mumbai, and specifically about 10,000 in Dharavi daily, because they are not able to get food grains. Similarly, we are also doing free eye care through a foundation. So we are both charity and private practice. So to Gitanjali's question, I hope Gitanjali, you understood how we are doing? Gitanjali?
Yeah, right, sir. I think it was well explained. And then let us start discussing with our panelists.
Yes.
So first is for Rajesh Wadda, sir. Sir, can you enlighten us about the regulation for the co-management? I think you did earlier also, but this forum also, there are many questions coming on the webinar that what are the regulations that are into force for co-management?
Rajesh is an optometrist and with a legal degree. So I hope everybody.
Thank you so much. It was excellent listening to Professor Natarajan, like always, and of course Thanuja and Oli have added to it, and the last presentation also. I could just see the primary thing is this telemedicine. The final right stays with the registered medical practitioner. Telemedicine has just been introduced in India as a legal entity from 22nd of March 2020, which was just a few weeks back. This is not a new law. Earlier, even this was not permitted. Now it is. For all the medical professionals, they can now do telemedicine. Means they will remotely get the information about the patient, and then they will prescribe as per their the clinical discretion and justification. In this, when the patient is at remote, not everything be done by the patient. So there is an optometrist who can give all these things, as Professor Natarajan had just listed out. He can do refraction, tonometry, whatever the inputs will be required by the ophthalmologist to reach a good diagnosis. Those will be provided by optometrists, and final decision and prescription will be of the ophthalmologist. This is a summary of the whole thing. And as the AHP bill comes in, maybe certain and optometry comes into a health profession, we may have some other rights to the optometrist. The scenario will change. It's still very fluid. As soon as this came in, the lockdown was there and not too much work could be done. Of course, all the medical professionals who wish to get into this will have to qualify through an online test in a certain period, which will be approximately 2 to 3 years. Within that much time, they pass an online exam and then they are permanently onto telemedicine, but that's for the medical profession. And as far as the optometrist is concerned, yes, his inputs will become very, very important in coming times, and will be able to increase our outreach tremendously. Thank you. Anything else you'd like to know?
Mr. Rajesh, no, I'm happy that you distinctly mentioned that the ownership lies with the ophthalmologist for the medical legal things. And I think people are concerned about or worried about the medical legal court cases going up. And I think we also had several lawyers in our webinars in ophthalmology mentioning about even treating during COVID with the limitation, how the patient can take. So I think as per the law, anybody can take to anybody to court, but I think we have to develop a relation with the patient so that they have trust with us. And only I think those sort of patients, it's not the idea of only making money. And I think we have to convey that together as optometrists and ophthalmologists. And the second part you mentioned about you have to pass an exam, exam or something for the medical professionals, sir?
Yeah.
What is that? I didn't know that.
All medical professionals will have to pass an online exam to get enrolled into telemedicine, but for that there is a period of 2 to 3 years, which within which they can continue practicing, but they must pass to continue practicing after that as telemedicine. That will be a simple exam to be conducted.
Okay, so maybe I should enroll. We should, in case you have details, you can email me, sir.
I'll do that.
I didn't know there was a. I'm also trying to get through all the. I think it's very good, but I think Thanuja will tell, and Oli and also Hamza will tell. In our hospital, whether it is a teleoptometry or within the hospital, everything we depend on optometrists. Even today, I want to give credit. I don't know whether Hamza is on the web right now in the Zoom with us, but I want to give credit to him because he is the man who's managing our Aditya hospital from day one daily. So he sees the patient. After that, the ophthalmologist come. Right now also, I went to the hospital and came. So I'm happy that Ansar is single-handedly seeing every call and also the video calls and everything. And then the ophthalmologist take over later. So we are already practicing from 1st April. And in the regular practice also, there are some patients who fight with me saying that I don't want to see the small girls then come to see you. We have come to see you, doctor, and she looks like a teenager. I said, yes, but I think they are qualified to do what they are qualified, like checking the vision, taking history, which I am not qualified. I'm qualified, but I'm not doing it. So I want you to spend time with my optometrist and then come to me. The reason is they take the history of such a thorough history is taken. Sometimes they talk to the patient for half an hour to 45 minutes. And I keep telling them, don't talk too much because they write all the history, including general surgery and whatever heart problems. But I think overall, we are happy that we are taking care of our patient as a whole. So I think our Aditya practice is 100% symbiotic. It is not dependent, and I think it's a co-management being done from day one, where optometrist does certain things and the ophthalmologist does certain things, which is clear distinction is there, and we always interact when there's like a pressure is high and why it's like that, or something to do with the cornea, anything. I mean, we interact with the optometrist, we make sure we see the patient together. Same thing can be done in teleoptometry, where even from Delhi, you have a patient opinion and we can use the software and do the treatment. The advantage of doing a teleoptometry and teleophthalmology is optometrists who are experienced and qualified can help us to diagnose so that our medical legal problems comes down to the minimum.
Thank you, Professor Natarajan. Just one little question popped up on the chat box. This exam and the course is to be done by the medical practitioner, not by the optometrist. So someone was asking, how can we apply and pass this exam? It will be by the ophthalmologist, not by the optometrist. Yes. Any other questions, please?
Great. I think I totally agree with Professor Natarajan sir's view that Aditya is one of the institute who is completely in synergy with the ophthalmologist and optometry co-working, like I've seen in Ali Prasad and Shankar Netrala, because that kind of trend is there. I think I was very fortunate to do my internship here and then got into the system and still practicing and doing in where I used to practice for 10 years, like in Krishna Eye Center. So this is the model which is the future. It's not about just isolating yourself and doing your job. It is practicing together, I think, lead to a better path. Now, I would like to invite KK sir, if he can enlighten us with some of the words about community optometry outreach post this scenario, how we can go ahead with.
I think thank you, Oli, and nice, wonderful presentation from my classmate at ESO, Tantan. I think nice to hear you after a long, long time. I want to reiterate again, she was a great teacher. She taught most of the Kansky by her mnemonic tactics. So anyone wants to learn Kansky, I think here is a person there. You can use all webinars there. Thank you, Tan.
And thank you, Kansky unfortunately died recently. And Kansky is originally from Poland, and he became my friend. And I think if I would have known, I would have told that I didn't know this.
Yeah, I think anyway, she's another Kansky for us. At least we call BO4, fourth batch of optometry in elite school. And thank you, Dr. Natarajan, for that wonderful vision. And I'm just looking at something more from this educational perspective. Now, the first and foremost is today with our existing curriculum, we are teaching the subjects and we are not teaching them how to do that thing. Only in few institutions where they go for training, we do have this kind of facility so that when they go back to their practice to adapt to such technique immediately. And the first and foremost, I think all the schools of optometry probably take the input from various experts like you and many others should try to create a curriculum which will be a good add-on to the existing curriculum so that when they come out, it will be more enabling. And second thing is, if you really look at predominant independent practice, to best of my knowledge, forget about odd man out like Rajesh, Ajit Bharadwaj, and very few to number. A majority of them, I could perceive that they are now only started thinking about, in addition to refraction, contact lens, and maybe they have added few binocular vision, some of you vision therapy. Very few people have added to these view of primary eye care into their practice itself. So I'm just looking at from the perspective that primary eye care means, suppose you can't just jump and do, if someone is in the practice for quite long time, but not practicing primary eye care, and jumping into any of these things will be more disastrous. So there should be an approach from the practitioner point of view. Beyond webinars, there should be some kind of hands-on on the specific common eye conditions, wherein, especially depending upon the region, you can, I think. So when Natarajan, when we used to teach our third years and third years especially, during the final year and part of the third year, we will ensure that common eye conditions. We have enumerated in a tertiary care like us around 42 eye conditions. We'll time and again try to bring them to their notice and try to have a lot of case discussion on that. Probably we should have as a team create such a document and also training protocol to ensure that we equip appropriately so that we don't miss you. But the evidences are very, very clear in terms of the ability of the optometrist. I'm just going through various literatures which gave us a lot of hope. I think I will just say one. In fact, way back, Hans Limay, I think you must be knowing Dr. Natarajan, that Hans Limay is from Rotterdam. In fact, we invited him, he is a glaucoma specialist. We invited him to give a talk in 2015 Evoke, especially on this front, because he established a unique model for connecting ophthalmologists and optometrists in Holland, which probably will be the ideal thing which you're talking now. Probably he was talking around that time, and he showed an evidences on that. And we had a workshop on that same line. Cutting it short, he trained people in glaucoma and some of the retinal condition. And then all the optometrists who came forward to support this initiative. And he ensured that after that he had a mock trial presentation and saw what percentage of people really equipped well. And those people who are equipped well, he just opened up the idea of why not we start connecting with each other. That means you have your own patient, you try to do all the procedure, send me all the required reports with all the information required, tell the patient that this is what exactly we are going to do. We are going to send it to the expert, and exactly the next day you try to bring the patient and have the report ready by end of the night. I think usually he says 10 to 15 cases he used to see around 10 o'clock night and send all the input to the concerned optometrist in a platform which they use. And the optometrist will share the same to the patient, and therefore he gets the benefit of getting the opinion not only from the optometrist as an expert, but also the ophthalmologist. The interesting aspect he told, probably this is what I actually think, he said in order to motivate the optometrist fraternity, he said we ensured that the share in this fees will be more for optometrists. After all, he's doing more, and the ophthalmologist should be generous enough. After all, he's going to get the other referrals in terms of surgery. In fact, he said once he started, many of the ophthalmologists in Netherlands have started using that technique more. Now today, in fact, he said this is originated from a dermatologist, and he started, was successful, and therefore Rotterdam picked up that idea. I think his study, which is presented in EVOC and later on in some of the ophthalmology forum, it showed that almost 32% referral to glaucoma, which is reduced to almost 10% after being properly trained, so that appropriate referrals came to their hospital. I feel it is the way forward. I think we can't avoid it. Maybe technology is going to enable this more, but at the same time, we should be very, very careful that we have to equip ourselves well before venturing into this area.
Very, very good. I just, excellent question, Kumar. And I think probably you should share us how you've done the share between ophthalmology and optometry, because I asked Ajit also, and I've told Akhil to work on it. In case you can email me, it's good. I just sent a note to my group. I think Thanuja can send it to Krishna Kumar. The collaborative telemedicine between optometry and ophthalmology, an initiative from the University of Houston. So I was doing some search about 10 days back how we can do. And already they have the impact of telemedicine on healthcare management as an abstract. They have published it. And the main thing is they have developed a strong telemedicine optometry ophthalmology program where patient care, clinical teaching, and research benefit from utilizing telemedicine technology. This initiative between optometry and ophthalmology is at the forefront of eye care. Presented here, clinical teaching opportunities via tele-education, that's what you mentioned, including retinal uveitic, neuro-ophthalmic disorders, and glaucoma. Seminars introduce students to this technology and enhance their clinical experience through exposure to eye pathologies, often related to systemic diseases. And the university also affiliated clinics include multidisciplinary centers staffed by optometrists, the Frost Eye Clinic with a HIV multidisciplinary care, Good Neighbor Health Clinic, and Rust School Health Management. I mean, these centers can converse online with eye care professionals. Large size interested in LVA rehabilitation include the several institutes they have given. And the residency program trains optometry in telemedicine, and the research program focuses on optics and imaging necessary to diagnose glaucoma, diabetic retinopathy, and neuro-ophthalmic. And I think something like this I want to do with Shankaranathala. I spoke to Dr. Sheila John and also Shankaranathala Academy, and maybe I didn't somehow I didn't communicate with you. You should think about it between the education part between Aditya Jyoth and Elite School on tele education program for the optometry. And as you rightly said, practice-wise, I think Elite School has been one of the basis of making a good combined patient care, which can be done. And I think it will be useful in diabetic retinopathy follow-up and glaucoma follow-up, where The follow-up is important, but at the same time, every follow-up you don't have to, the ophthalmologist need not see the patient physically. They can do through teleophthalmology.
Great, sir. That was, I think, wonderful from both KK sir and Natarajan sir. Can Ajit sir add up to this couple of points in terms of the future programs that can have on practical aspect? Is Ajit sir is there?
Yeah, Tanu, am I here?
Yes.
Am I audible? Yeah. Yeah, Tanuja, thanks a lot for showing your journey of life and the way you have presented, the way you have come up from Chennai to Mumbai to now Botswana, and the kind of the motivation, the kind of inspiration you give it to us, that how much work you do for community and how much work you do for poor people. That's something what optometrists need to look at and incorporate within their system. That's something which is missing here. Well, Oli, you have presented a very good idea on how we can do this teleoptometry model, checking the vision, which somehow are something which we are collecting and you have just in one package. That will something help us to spread teleoptometry model. And thank you, Dr. Natarajan, for your great vision, what you inspired us with your statement, what you mentioned, arise, awake, and not stop till the goal is achieved. Something that I've just a very good learning for me. And I will request all optometrists to think deeply on this point. And, he is not just a retina specialist, he's a visionary, has set up institutions like this where many optometrists, are nurturing themselves to a good contributor to society. Let me tell you, teleophthalmology, teleoptometry is not the future, it is the present. And what inspires me most is that when other ophthalmology institutions are just thinking about it, Dr. Natarajan has taken initiative to set up a business model for all optometrists to be a part of it. So optometry need to see that this opportunity is here, and if the kind of role what we can play in early detection, in the diagnosis and prevention, that is the role we have to play, and we have to reinforce in our practice that preventive role what you can play, an ophthalmologist or retina specialist doesn't have time to play. Understand, they are very, very busy people. If you look at the specialty of ophthalmology, retina specialists are highest in demand. They are most highly paid specialty of ophthalmology, and they don't have time. Look at the number of people with diabetes, 77, 78 million people. 1/6 of them will definitely develop diabetic retinopathy. That means 12 million people will have diabetic retinopathy. Out of 12 million, 1/6 of this means about 2 million people will have proliferative, sight-threatening diabetes. 2 million people with that kind of a diabetes, and do they have time to look at, diabetic which is just setting in? No, there is no time with them. We have to bring in our scope of practice, and this is the time. He has opened up the chapter for all of us, and this is something we have to see how we can educate ourselves, learn, equip, and set in. This is the time, and I will see that. We are collecting the list of optometrists. I'll send it to Dr. Natarajan.
Yes.
People have coming forward that they want to be a part of the model, and I will request them that just number what we are getting is very minuscule. Out of 40,000 of you sitting there, if you just look at refraction, I told you many times, refraction, contact lenses will not give you anything. The kind of shortcut competition that have been set in by these optical chains will not lead you anywhere. You have to think of different ways of getting into co-management. Otherwise, you will not be able to survive. You will not have a future. So I, being somebody who has led my life, I earned good living with diffraction contact lenses few years back. But last few years, I'm struggling. I'm telling you the fact of life. I'm really struggling last 5-6 years since this all change came in. We have no way except to find our future collaborating with ophthalmologists on these models which he has come forward. And I thank Dr. Natarajan for this idea, and we will all be glad, and we will look forward that we give a sizable number of optometrists who are willing to be part of this. Jyot se Jyot Jalao. Thank you very much.
So Ajit, I think today's webinar, I got the inspiration from you when the first webinar you invited me. and the second webinar on retina specialist and optometrist, your own brother. And then luckily I knew the consultant also. And then the third webinar. So I think thanks to Oli for putting me with you. And you also remember your old time in Mumbai. So you are the inspiration for this webinar. And also, I think even though it was there, and I think with your motivation, I'm pushing Akhil to make it happen. And I said, it's like whatever model, whichever way, I think we have to make a projection to the public that we are coming together to serve you, and at the same time pay us the professional fee, not that we are looting you. So that impression we have to create. It's not that we're like you told all your practical problems of current optometry, and same thing with ophthalmology also. Every street has an eye doctor. Every street has maybe 2-3 optical shop, and so I think maybe that's there. But I think the population is increasing. Instead of telling anything else, I think we have to think of all the time out of the box how to touch the heart of the patient. And you rightly touched, if you can be a co-management guy for a diabetic patient. Imagine you just ask them, how are you? How's your diabetes? And even in my clinic, I think many patients are attached to the optometrist because they ask the history. What is the medicine you're taking? Are you regular? How's your HbA1c? When they know, and the second time when they come and they read the computer and say, last time you came, HbA1c was good, now it's there. So they can develop a personal rapport. So we can have a practice which has some love and affection for the patient. I think that because when it's lacking only that doctors are getting beaten up or somebody blames us, we are making money. I think we can add that compassion to medicine, which is what Dr. Abdul Kalam always told me, which should be there. I think we have to, when we start this proliferating, and I hope everybody picks up this idea, optometry, ophthalmology as a business model. But I think they should keep that ingredient of love and affection towards patient. And whether the patient pays little or more, I think if we show we are loving the patient, I think nobody will take us to court. Even though law, we have Rajesh to guide us. But
I really appreciate your point of view, because the model you have a model for both. You have a model for patients who can pay, and you have a model for people who have charity. So if you want to extend that model to your rural population, he has a model. At the same time, people who are sitting in cities have a model.
We have got a company where I forgot Hexilon. I think Dr. Akhil, you have the slides of Hexilon or Helixon? Helixon, no? Akhil?
I think it's muted. He needs to.
Muted. Akhil?
Hold on, sir. I'm just connecting him.
So Thanuja is representing optometry well with having a colorful frame.
Yes.
Right.
So coming back to your webinar, I'll share your how we started. 3 of us, me, Rajesh, and Monica, we said that since there's nothing much to do during this COVID time, we said let's do a webinar and talk to our colleague about the ASP bills. The idea started from the bill, not from the education. And then when we did, we were so much discouraged by our own colleagues. They said, what are you doing? Who is there to listen to you? Who comes? You will see only 5-10 people coming. I said, as it is, we are sitting alone. Even if 5-10 comes, there's no problem. We'll talk to 5-10. And then we saw people were really interested to know. And we have started with some first webinar we had 60 people. And now we are heard by at least 2,000 people in every webinar. So this is something what we are learning from this from the group what we have.
I can say that every time there are new people joining, learning, and the second is thanks to technology and Oli.
Yes, thanks to Oli, because he made us to see that this is the way it is possible.
We didn't know. He's also putting the recorded one.
Exactly.
When we can go back. You won't believe. I told my secretary, I think she's on the group. I told her go through all the webinars. She said, "Where is it?" I said, "Oli has it. You call him. We'll send it." I had it. I said, you go through it. I said, I wanted everybody, I want my watchman to the chairman in the hospital to know what is tele optometry and tele ophthalmology. And I think we have that Helixon, which we are actually going to do free for Dharavi.
So one request, I will use this platform for you. I mean, it's a personal request. You see, what I heard in your presentation, you have a diabetic retinopathy task force. I would suggest that you have 1 or 2 optometrists involved in it.
Good idea.
The reason is this, that you will have a different perspective. I'll tell you, very simple. We were conducting a rural eye camp whereby we were identifying cataract and bringing them to city. Somehow they had no access to checking their blood sugar. So I said that, how do we do it? So one of the optometrist there sitting in the village. He has been there for a long time. He said, sir, I have a local guy. He's a local RMP. He will be able to diagnose who has diabetes or not. And then I was surprised that the number of patients he was sending, none of them has diabetes. So I said, how the hell he's doing without any instrument, without his. He said he has a simple way of testing them, that he asked all the villagers to urinate in the night at one particular place and different places. And those who have diabetes, they will have a lot of ants collected near them. And he said, no, go and treat your diabetes. And something very simple interventions, which I felt it worked for us. When we tested them in the hospital we were conducting at Lions, we didn't find anybody who who had diabetes from that village.
Oh.
So, yeah, I mean, some interventions which people think out of box. That's what I said.
We need all of them, because as you said, 77 million. To get the 2 million, we have to examine the 77 million.
77 million.
And then and even optometrists don't have time. And that's why I introduced many. So you're right. I think all of us have to work together. And as you rightly said, our own profession, people are worried, oh, you are doing this, you are doing that, how will we survive? But I think they're not able to understand 1.3 billion people. Everybody has 2 eyes. So,
add to this, I remember that when we started Aditya Foundation for Twinkling Little Eyes and the Dharavi Center, me, then Vikrant, Divya, and then Aditya, the students were part of AJ study. I think we published in ophthalmic epidemiology.
Yes.
So there was a large-scale study on diabetic retinopathy in the slum of Mumbai.
Yes.
I think so. Optometrists are very much part of all the initiative of the Twinkling Little Eyes, and still continues. I think led by all the optometrists.
What's his name? Akhil, yesterday we did a meeting with all the optometrists. So I have told them on May 7th, there is an article published in Nature. Nature is the highest impact journal. It is published by the Italian group of comparing ocular trauma between 2019, February, March, and 2020. So yesterday I told our optometrist Ansar, and I just now went in the morning to the hospital. I told that optometrists who will be involved will be a co-author, and we will try to publish an article in Nature. What was the amount of injury last year in the same month, March, April, and this year, all over, at least between JJ Hospital, Sion Hospital, IIT, and we want to publish that because the trauma is increasing and everywhere. And the first person examining IIT is Ansar, and he's an optometrist.
Yeah.
And this is what I want to tell the world, that we have to work, even during COVID, the optometrist role is there.
Great. I think before we conclude the session, there was a question on the HIPAA compliance or some regulatory compliance for the web platform where you are storing the patient data. So post-COVID, I think there are a lot of relaxation from the US FDA on the HIPAA compliance. It is not strict now, though platform like Binox that I have is the same rules and regulation that being followed in HIPAA is being followed. It is double encrypted data. Whichever platform you use, make sure that they are double encrypted so that the data are safe of your patient. That is the one criteria. Otherwise, you can land up in a major issue. Now, I think we have taken all the questions and great discussion. So probably Natarajan sir.
Something, Thanuja, you were mentioning about starting the teleoptometry with Botswana ophthalmologists.
Yes. Yes, because the number of ophthalmologists in the country is very limited, and plus they are more specialized into the anterior segment, and we don't have retinal specialists out here, not only for private patients, but also the patients backlogged at the government hospitals. So teleophthalmology and optometry is the way to go. It will be very useful for the country of Botswana if we link it up. And some of the patients are sent to South Africa, and the cost is also very high there. But when the quality of service as well as the cost will be economical if you send the patients to India. And we can also speak to the medical aid schemes to come into existence and support the cost. And then the patient's cost would be only on transport and accommodation.
Right.
That's great.
Good. Only KK was raising his hand in between.
Whom?
Krishna Kumar wanted to say something, I think, after the Thanuja's thing. KK?
Yeah, I'm just trying to connect him. Yes.
Jyoti Dave also has raised her hand. Jyoti Dave is on the line.
Right. So I'm connecting both of them.
Right.
Right. Jyoti ma'am, can you come up with?
Yeah,
Jyoti?
hi,
Hi, Jyoti.
Dr. Natarajan, hi, Jyoti here.
Why can't you show your video, Jyoti?
Because I'm not in the right state to show my face.
Okay. Anyway, so I
Nati,
want to tell.
Nati, I'll show
No,
you my
before
face in a private conversation.
no, before you start, I want to tell Jyoti and my brother and probably Rajesh and all were part of the London School of Optometry in 1984, right?
Correct, 83 actually.
83, okay.
Yes, yes.
So at that time, I was only a postgraduate student in ophthalmology, and I was envious about my brother going abroad that time because I went abroad only in 89. Now anyway, every week I go. So anyhow, Jyoti is known to me from that time. And, thank you, Jyoti. Yes, you were saying something.
Thank you. I had a very, very good, I unfortunately missed most of your session, but I did attend the previous one. And talking about what Thanuja is, continuing with what Thanuja is suggesting, even in UK, you know, the national health system in ophthalmology is so overcrowded and so there are lots and lots of delay. So I think the UK government has got a bilateral agreement with Indian government that certain patients can be treated in India and they would be compensated by the National Health Service in UK. And I think this teleophthalmology, if we can also, along with South Africa, we can, along with Thanuja, Botswana, we can also do it in countries like UK, it might work. And I think it will work very well.
I think that's a great addition to the comments that Thanuja ma'am was adding. Thank you, Jyoti ma'am, for adding your valuable comments.
Oli, in the
Yes.
chat, I saw, what is that? What do we take up?
So we have taken up the questions of in the chat.
There's something about Madhavi Panchami has written about, can you share some detail about the business model? I think
I'll
Akhil can write.
to
She
share.
can probably send an email and Akhil can write to her.
Yes, correct. We'll do that.
So can you share the Akhil's email, please? Can you share through the group
Yeah,
here?
Akhil, can you
Is
type
it
your
there?
email to everybody?
I am him, he's not there, so we'll ask him to share the details later
Okay,
on.
we'll share. Thank you.
I'll share
Okay.
with,
So we will say, I'll send, I think we will ask him to email to all the participants today.
correct.
And
Can,
is Krishna Kumar there? He's there, he's on the line. Yeah, Krishna Kumar, solunga.
Yeah. What exactly the thing? Sorry.
No, you raised your hand when.
Yeah. No. In fact, I was just sharing about one of the initiative. It's on co-management at what we did in with Dr. LV and team. In fact, we started something called Glaucoma Review Clinic. And in that glaucoma review clinic, when the patient comes for review, it will not be seen by the glaucoma expert. It will be seen by optometrists in glaucoma department who are trained for that. And only those cases where there is an indications, it will be referred to ophthalmologist. And that was very successful at Natarajan. In fact, it brought down the burden of almost 30 to 40% for ophthalmologists, and ophthalmologists could take more of surgical case opinions there. So this, I think this naturally can be extrapolated to tele-optometry so that even the patient need not to travel all the way to the hospital. And that was a very good initiative. So there are a lot of nitty-gritty informations are there already available in the literature, which we can take it and see how it can transform the Indian vision care and eye care industry. So.
No, we have this Panicker, the elite school optometry, no? Panicker. So I think I'm happy with his academic growth, and I think he's been treated as something like a glaucoma expert, even though he's a PhD in optometry. And I think that's because he's taking a big role, and then he was supposed to bring his university team to Mumbai in January. I think something happened, and I also couldn't. We were supposed to visit in this April during the RO, but anyway, everything got totally. But I think what I'm trying to say, optometrists have a big role in diabetic retinopathy and glaucoma co-management. And I think the business part I'm including because it has to be a co-management fee. So the optometry gets for his job. And that's why I'm using the word professional fee. for a professional, and eye doctor for the treatment and everything. And finally, the medical legal importance or medical legal responsibility lies with the doctor, because if you tell the patient something, doctor is responsible. And even telemedicine prescriptions or advice goes with the digital signature.
Yeah.
And as we said, the legal part you have to keep remembering. It is like exactly practicing the same way. And when you can't diagnose and prescribe, I think better to document it. You're not able to diagnose. And simple is to tell the patient, you have to go to an eye doctor, and then after that only we'll give you a conclusion. And I insist that nowadays there are every day somebody calls, known people just like the 12 o'clock call me and say, I read what to do. And then I tell them, please consult with the telemedicine. We have a telemedicine. So that the person has the relevant questions are asked. In the midnight, you miss a question, then you will be blamed for it. Because redness can be conjunctivitis, can be glaucoma, acute congestive glaucoma, or it can be uveitis. So you cannot just give a drops and forget it. So I think you have to be patient. Also, we have to train them to be responsible. And I think we have to make some public television programs, whoever is possible to do it. And I'm trying to do how we can do eye care without crowding, because I think the next 2 years, the crowding of any place is not good, whether government tells or not. I think we should do that. So instead of 100 patients coming to one place, they can be divided into 10 optometrists and go 10-10. Even if the clinic looks small, I think we can do better. And there's some, definitely the share will be less, but the share is more. And you do more patients daily, and everybody will be able to do the physical distancing, and then make sure we prevent corona, and same time also do revenue generation and do a best eye care to the patient.
Thank you.
Yeah, I think that is the great idea to like separate or segregate the patient into multiple clinics so that the place do not get congested at one time or point of time. And it was a great insight to discuss all this tele optometry and tele ophthalmology co-management platform with all the esteemed.
Sure. So I think Ajit, from this, I'm saying in next 2 weeks we should do a tele same thing, but for public. So here it was for optometrists mainly, and maybe ophthalmologists were there. But I want that we have to do it for public, so the public knows the ophthalmologists, optometrists are together ready to serve you, and we can have a more generalized talk. And we can also, by the time we have some experience, we can tell how the patient can take the benefit, and also taking some responsibility that there is a limitation of the telemedicine in a lockdown. And post-lockdown, I think things are easy, because you'll do the field of vision, you'll do the whatever corneal measurements, anything you get ophthalmologist wants, you will do it in your clinic, and you can send it, and the patient can do the anywhere. Great, Oli, and I think I thank all the speakers, and specifically I'm happy that even though it is a total Ayurvedic product, but I'm happy we are all coming from the grandmother, that is Shankar Netarajan. So I'm happy I'm a product, Krishna Kumar, then Thanuja, and all of us, and then our own Ayurvedic. It's nothing, I mean, we are just want to be proud of our, and the whole thing is, the entire, the thing is, Government Eye Hospital Madras is the mother of mother institutions, and which I'm glad last year in All India we had that as a team, 200 years of glorious years of modern ophthalmology in India, and they put the eye hospital as the main backdrop in the conference in Indore. So similarly, I think first optometry also was started in eye hospital. So I thank right from them who were able to think about optometry from 1948. Also in 1819, the eye hospital was started. I'm sure that time also the optometry, whatever they were doing, we don't have records. It's a good homework to do. There's a beautiful article written in the current science about 200 years of government eye hospital, just came last month. Now I'm writing an article on Elliott School of Ophthalmology, which will, I think, definitely have something in optometry. So I'll dig out history, and I think we should work on it, and probably think about daily education, which Krishna Kumar can take the lead. Because Shankar had ekalvia.org, I think probably, I don't know what's happening now, but if something like that, you can start in optometry, and maybe if you want, both Aditya can join and do something, and we can get some grants for running it.
Thank you, sir. And a very small announcement for the participant or the students across the globe. We'll be inviting you to send your protocol on teleoptometry or teleophthalmology poster, and we'll be choosing one of the winner from them, and there will be surprise.
Yeah. No, I think not only poster, Oli, I actually wanted all the, it should be open only for the students because they are going to be future optometrists, and other people can be judges, whoever wants to write also. I want them to write an article also. Unfortunately, I could not finalize with the company to give the first, second, third prize. I think maybe we can keep 2 weeks as the last date. In the meantime, I'll work with some companies to get a good first prize, second prize, third prize, and maybe some more prizes to encourage. And they should reach every student of optometry in India.
Great, sir.
And Krishna Kumar, I think I want you to help us to design a circular which we can send jointly to all the students.
Definitely, we'll do that, and then we'll invite the applicants or the participants.
Thank you, Oli.
Thank you. Thank you. Thank you, sir.
Thank you, everyone. Wonderful to be there. Thank
Thank
you.
you, everyone. Thank you.
Oli,
Yeah.
can a few of us be in the thing? Can and everybody else can go like me, you, and Hamza and Thanuja?
Sure. We want to stay back?
You can off the screen now, and rest can go because I
Thank you.
Bye-bye. Thank you all.
Yes, thank you, Krishna Kumar. Thank you, Ajit.
Thank you, sir. Thank you. Appreciate it.
So you can keep 4 of us. I think Akil is not there, I think. Yeah?